Hi, my name is Ashley Prosper, and I am a cardiothoracic radiologist within the Department of Radiological Sciences at the University of California at Los Angeles. My research interests include the early detection of lung cancer, particularly utilizing lung cancer screening with low-dose CT, improving cardiac biomarkers for the evaluation of Duchenne's muscular dystrophy, and improving imaging techniques for the evaluation of congenital heart disease. I found out about radiology in a sort of roundabout way. I will always have one of my med school classmates to thank for helping me figure out that radiology was the career for me. We were having lunch outdoors in the med school quad, and I met her partner who asked me what I wanted to do with my life. When I talked about the interest that I had in cardiology, it really was related to some of the 3D visualization that I saw them use in the cath lab. And this individual happened to be the program director of the radiology residency program at my school and said, you should really check out cardiac imaging and see if that's more up your alley. Turned out that it was. I ended up pairing up with a mentor and actually earned a RSNA trainee research prize. And from there, it was radiology for me. I think that I'm still relatively junior in my career. I'm just about 1 month shy of completing my 5th year out of postgraduate training. So I hope that my greatest career accomplishments are still ahead of me. That said, the thing that I'm most excited and most proud of is that I was able to find an academic home to begin my career in. UCLA has been really supportive, and I've met fantastic colleagues and friends here who I'm able to further my career alongside. So I'm really grateful for the mentorship and support that I've found that's helped me have some early career success, and I hope that this is just the beginning. Being in a really rich academic environment poses a situation that I think is both a fantastic strength and a challenge, and that is that there are so many incredible opportunities. As a new faculty member, it's really tempting to say yes to every opportunity. And while you do want to get your feet wet and participate in as much as you can, you have to be careful about overburdening yourself. And so being selective, staying true to your mission, and knowing what your ultimate goals are some of the hardest things to do when you're fresh out of training. And it's something that I'm still working on. Fortunately, I have mentors who help me to stay focused on those goals and to really strategize to make sure that I'm on the right path. RSNA is just chock full with resources. It's hard to just pick a few resources that I use most frequently, but the first one that comes to mind is radiographics. I love being able to refer to it when I'm at the workstation, whether it be that there's something that I need to refresh my memory on, or I'm trying to pull up a specific graphic or an illustration to help a trainee understand a difficult concept. Sometimes I'll even, find a link to a radiographics article and send it to a trainee to help them further their knowledge after we've read out a case that I want them to really remember. So it's a fantastic tool to have that at the ready and to be able to access it online in an instant. I consider myself to be really fortunate in that I've met some fantastic individuals along the way as I've trained through medical school, internship, residency, fellowship, and encountered new friends as I started my career. So when I'm not working, one of the things I really try to do is to stay in good contact and visit some of these people as we've dispersed across the country. So traveling to see these friends, particularly now as COVID restrictions have eased, has been a really important activity for me. I also really enjoy cooking and baking, and to sort of support those habits, I try to make time for my Peloton bike too.